So this is part 2 of our time this evening, and I really hope that you enjoy the ability to be able to bring webinars from anywhere in the world to where you are in Taiwan, because with our travel schedule, as Joeson knew, it was impossible for me to come to Taiwan last year because we were in Cambodia and we couldn't change our flights without a problem. Same thing is happening, by the way, this May, when the Australian Veterinary Medical Association had invited me to give talks at the end of May when I was going to New Zealand to speak and being close by. But all of a sudden they changed their meeting to the middle of May, and in order to change our ticket from Italy, where we will be at the time, to Australia, it would cost $2,500. So we had to figure out some other way to do it. So you never know where you are. Webinars are another obvious solution to be able to bring education to all of us together wherever we are in the world. Thank God. Okay, let's talk a little bit about HemoPet's specialty diagnostic lab, which is called HemoLife, the rising sun here. We do any testing that veterinarians need throughout the world, but the specialty diagnostics are done specifically at HemoPet and only by them, and we're the only specialty diagnostic lab in the world that does thyroid measurements, the whole of the assays I talked to you before, without using radioactivity. So we use no radioisotopes in our thyroid testing, and we don't use radioisotopes at all in our laboratory because I refuse to contaminate the earth anymore, even though everybody says these things are safe, and we know actually that they cannot be safe. It's impossible to control radioactivity completely in the world, never mind what's coming to us from above when the ozone layer is being depleted. So HemoPet has a series of 7 patents that apply to dogs, cats, and horses throughout the world with thyroid testing and our food intolerance. These are all patented and they're unique. So we're very proud of the fact that we can bring these measurements to you whenever you ask for it without using radioisotopes in our laboratory. Now, we talked before about the estrus cycle of the intact female and how this can impact on measuring hormone levels, and especially thyroid hormone levels. It's interesting that this slide has a little mark on it, which I've never been able to get rid of, but whatever. Anyway, from the textbook that we're all taught as young students, the heat cycle of the dog is shown to be average of 6 months. And the cycle includes this rectangular box every 6 months. Well, obviously you know that the female doesn't read the textbook. The female decides what she's going to do about her estrus cycles. And in some breeds of dogs, for example, the estrus cycle can be shorter, 4 or 5 months apart. It can be much longer, like in a breed, the Vizsla, that I used to raise. It could be 10 or 12 months apart. And sexual maturity or puberty in the female dog can be as early as 7 months, perhaps even 6 months, and as late as 2 years. Some breeds don't even have an estrus until they're 2 years of age, and then after that, the cycles have a normal pattern. And so it depends a little bit on the breed and the family history of when you would expect a healthy female to come into estrus when she's not spayed. And you know, I'm sure you know, there's a big controversy even now about whether female neutered and spayed and neutered, and whether that affects their longevity and their health. And we know that in males, they say that even neutering a male at very early in life does not affect their long-range health. It certainly affects their susceptibility to prostatic infections later on in life. But we know that in females, it's much more controversial than that. And there are published data that have shown that if you spay a female before 12 weeks of age, you do affect her development, her muscular development. She's more prone to urinary incontinence and leaking urine as she gets into midlife. And it changes, of course, their life cycle. It may reduce the likelihood of mammary cancer, but really not necessarily. So there's been a huge emphasis now worldwide to spay intact females later on in life. certainly after 6 months of age, and in some cases not until they're 2 or 3. So it's a judgment call now. There's many changes about that. And breeders, after they've used the female for breeding 1 or 2 or 3 times maximum, those animals should be spayed. And the spay should be done in between heats, just like testing for thyroid function should be in between heats when the animal is sex hormonally neutral, quiescent. And esters, or sex hormonal quiescence, in the female is 12 to 16 weeks after the onset of the prior heat. So that's the beginning of the heat. You count 12 to 16 weeks forward, and you spay them, or you do testing for anything, hip dysplasia, eye diseases, blood diseases, anything. When they're healthy, for genetic screening, you do it in between heats. And it doesn't matter if the heat cycle is 8 or 10 months long. You still do it 12 to 16 weeks after the onset of the prior heat. Now, you'll see that this is important in terms of when anestrus begins. So when you're testing a healthy female that's intact, the first time you do thyroid testing at puberty should be after she's had her first maiden heat, because you don't know exactly when that's going to be. So once she's had her first maiden heat, when you first notice changes in her vulva, thickening of the vulva or turgidity or interest of male dogs in the household, even though she's not bleeding yet, you count 12 to 16 weeks forward, and that's when you do your first thyroid check for screening for autoimmune or other forms of thyroid disease. Now let's look at the clinical signs of hypothyroidism in the dog. Remember, thyroid hormone, the thyroid gland is a major master gland. It takes all its messages from the pituitary gland in the head. So the pituitary gland controls everything. It tells the thyroid gland what to do. The thyroid gland then controls all of the metabolism in the body, including how the body handles proteins, fats, and carbohydrates, and enzymes, and whatever. So it's important that the thyroid gland function normally to keep an individual healthy and live a long time. So what happens when the metabolism of cells is interrupted because the gland is hypothyroid? Lethargy, the blahs, as we mentioned below, mentally dull. Duh, where am I? Who am I? Exercise intolerance. You're taking the animal for a walk every night. All of a sudden you're walking and the animal doesn't want to walk very far, which is the opposite of what usually happens. Neurological signs. Now that could be a type of seizure. It could be some other kind of twitching, something that seems to be affected by the brain or the spinal cord. It could be a polyneuropathy, which is a lazy leg syndrome. And some giant breeds have that. They stand with their legs sort of partially buckled under, like a horse could. You can have seizures that are not epilepsy, that are controlled by the pituitary thyroid gland being improperly active. Weight gain, we talked about that. Hating the cold, I showed you the picture of that little dog under a blanket. Moodiness, hyperexcitability, stunted growth. The animal grows magnificently until it's about a year of age, and all of a sudden it never matures. It looks like a puppy. Now, many of these animals that mature fast win their championships in the show ring, but they can't be shown anymore because they fall apart by the time they're 2 or 3 or 4. You don't want that. You want them to grow and mature and fill out gradually so that in between 2 and 5 years of age, they're in the prime of life. Chronic infections, as we talked about before. Now here's an example of an Akita. This Akita has severe obesity. She's an American-Canadian champion after she became a champion, and this lady that had her is a friend of mine in Michigan. After she became a champion, all of a sudden she got getting fatter and fatter and fatter. She had huge weight gain over her shoulders here. So she was competing in agility after her show champions, and she couldn't jump. No way. But interestingly enough, contrary to what many veterinarians may be looking for, her hair coat and her skin look pretty normal. The only thing odd is her tremendous gain in weight. So what we had to do was test her thyroid function. And I'm not sure what that noise is. When we tested her thyroid function, she was hypothyroid, and we treated her with thyroid hormone. And you can see now that you can see the muscles, and she's got good weight here, and she's really, really much healthier. Remember, before she looked like this. So she became normal, and recently the client, a friend of mine, sent me a picture of this dog when she's 14 years old. Still taking thyroid hormone. Look how happy she is. Look how beautiful her face is. Look how beautiful her body is. This dog is now 14 years of age, which is an old age for Nikita, and she looks fantastic. Here's a dog that was obese and hypothyroid, looked like a turkey. She had lots of funny hair and skin issues down here, but she was clearly obese. She looked like a golden retriever, but it turned out once we diagnosed her thyroid disease and she lost weight, she was obviously a mixed breed dog. She had some golden retriever in her, but you see she's still got bad skin. So most of the time when veterinarians and pet owners think their dog is hypothyroid, they have skin disease. So this is the common diagnosis before we think of behavior and all the other things that metabolism that's wonky can show you. Excuse me. Skin diseases can be dry, scaly skin and dandruff. So constant dandruff, the skin is not right, the coat is dry, doesn't matter how much oil you put in the food, this coat doesn't shine well. You can have loss of hair in many cases. Now, the Akita didn't show that, remember? She had obesity first. Bilaterally, because it's hormonal central, the hair loss is on both sides of the body. You can have what's called a rat tail. And feathering on the tail, if it's a dog with a feather, normally is gone. Or you can have a fluffy, poor textured puppy coat without any normal undercoat that would give it stability. You can have extra pigmentation. So the skin turns black and dark gray and has even taupe brown colored spots on it. And I'll show you some pictures. The skin can be oily, which is called seborrhea oleosa. And when you squeeze the hair and skin of the oily dogs, the oil actually comes out on your fingers. We have to wash those dogs in tar sulfur shampoo to remove the oil. It's obviously not normal. Seborrhea is the dry coat. It's dry and flaky and full of dandruff. You get chronic infections of the skin, pyoderma, and because the animal's itchy from the dry skin primarily, and so they're scratching themselves all the time, and they get secondary infections from scratching the skin open. You can have mixed edema, which we don't commonly see in animals, but occur in people with this kind of thyroidism, and the skin smells awful. Oops, that should have been white, sorry. Skin smells terrible. It smells like rancid, spoiled butter or beer. So here's another, just happens to be an Akita case. There were 23 Akitas kept on this farm in Arizona, and they weren't fed or cared for properly. This is Casey, and Casey has lost her hair here. It's a horrible semi-rat tail. She has a woolly coat. The hair is growing every which way, not the normal way the coat should have. And when you look more carefully, I'll show you here, she's got chronic skin infection. And she looks sad, poor thing. Here's a close-up of her skin, and she's been scrubbed. Got secondary skin infections here. You maybe, if you look closely, you can see droplets of oil. There's also oily skin as well as dry skin, and she's got pus coming out here from the sores. That's secondary to the hypothyroidism. Now, if you turn Casey over, you'll see what I talked about with hyperpigmentation. This is called Acanthosis nigricans, and it was first recognized in the Dachshund breed, by the way, with this strange gray, leathery, almost armadillo-like skin. By the time this occurs, and Casey's obviously an end-stage case, any person can usually diagnose it. But often what you might see is just a little bit like this underneath the dog, a dry, semi-gray, patchy, thickened area, or you could instead just see these taupe-like collarettes with lace, like a lacy taupe-colored patches on the abdomen when you turn the dog over. Here's a classical rat tail. Here's a Scottie with no hair. This poor Scottie, Scottish Terriers, being terriers, of course, have a terrier temperament, and sometimes they don't want to be messed with. And so this poor dog, and this is a private home picture, so it's just a Polaroid. It's not very clear. You can't see him. This eye is looking at the camera. This eye is sort of semi-blah, but he's lost hair. He doesn't have very many sores. He has no hair on his body and none on his tail. So he had a naked body and tail, and he was diagnosed as hypothyroid. Once he was put on thyroid, see the hair grew in beautifully, starting to grow on his tail again, and his body nice and smooth. And he's also now looking at you like a healthy terrier should. I don't think you want to try to pick me up now. Thank you very much. I'm fine. Just try. See what happens. So he's got his terrier temperament back as well. Here's a very interesting picture. This is a pointer who happened to be solid black. What I want you to look at here is he had chronic itching, and so the owners, not knowing any better, put bandages on his feet so he couldn't itch and cause sores on his skin, and they covered them with duct tape so that they would be waterproof. What the owner didn't realize was that dogs sweat through their feet. And so this poor dog could only sweat through his front feet, and by panting a little bit, he could not sweat at all. And when he took off the bandages to change them, you can imagine the smell. The poor dog was horrible. And you can see that he lost so much of his hair here, all over his front, down both legs. But interestingly, if you look at his face, look how sad his eyes are. This is the tragic expression of hypothyroidism. And I always laugh when my husband Charles and I travel all over the world and we walk down the street and we're looking at dogs, and I'm always looking at them and saying, that one's hypothyroid, that one's hypothyroid, that one's not. Because I can look in their eyes and I can look at their body and I can look at how they're walking. And he says, oh, be quiet, Jean, you can't say that. I said, I'm not going to tell them, I'm just telling you. Now, interestingly, this is a very unusual picture. You rarely see a picture like this where the hair loss is truly centrally hormonal because it affects both sides of the body, and this was not from a clipper. This dog naturally lost his hair on both sides of his body. That's an amazing photograph. So if you see that, you know what it is. But I would bet that most veterinarians will never see this classical hair loss case at this stage in their career. But here's an interesting thing to do. And now that all of you have cell phones, I'm sure you can take pictures of your dog. You're going to have your dog have an annual checkup. But please take pictures of your dog once or twice a year. The whole dog from the side maybe, the back, the front, and especially take pictures of the face. Here's a golden retriever in 2010, looking perfectly happy. Nice face. Here's the same dog a year later with a picture. Look at this. Look how tragic the dog looks like. The color is going off the face. It's washed out. The dog looks anxious. He's got more of a problem here, not as much space in the head. And here he is 2 years after the first picture, and this has progressed to the point where his coloring's about the same, but he's very, very sad. So he's lost his muscle mass under his eyes. This dog is classically hypothyroid. Now here's an Irish Water Spaniel, and this dog was hypothyroid, but his owner, who's the breeder actually, from the United Kingdom in this case, is someone I know personally, and the dog had some lightening of the coat. You know, Irish Water Spaniels should have deep, rich chocolate coat. And this one was fading, and she didn't realize it, but she bred the dog, and many of these diseases can still be fertile and become pregnant. So don't assume that if they're hypothyroid, they'll be sterile. Okay, so she had a litter, and after her litter, she lost all her hair here. You can see that. Oops, all the hair. And it's a totally bright, faded color. She had some eye discharge as well. So this dog was clearly not well. So we diagnosed the hypothyroidism, and she was put on treatment. And wait till you see what she looks like afterwards. This is an amazing recovery. This is the same dog in the same yard after being treated for hypothyroidism. Look how lush the coat and wonderfully chocolate colored it is. So remember, here she was after having her litter. And remember, the stress of carrying the litter affected her thyroid demands even more. She looks scruffy, her ears have very short hair. She's just a mess. And here she is afterwards. Wonderful. And of course, the breeder would never breed the dog again because she didn't want to pass it on to any of the offspring. Here's a dog in Holland from the same lady I talked to you about before, Dr. Linda Bogie, and this is a Cocker Spaniel with crusty skin. And recall, this is different from the taupe lacy pictures I showed you before with the Akita. These are called epidermal collarettes. And so there's a circle, like a collarette, and the crusts ooze some serum here, and they become crusty. And sometimes there'll be an onion skin over the outside, but I'll show you a picture of that. Now, not only was she hypothyroid, she had a bad coat, very fluffy, thin coat, and here it is all matted underneath to show you that her coat texture wasn't right. Here's a very interesting case. I think this is, hold on, let me just make sure this is the right one. Yep, this is the right one, sorry. This is a Portuguese water dog with Addison's disease, and she's 16 months old. Sorry, the old is pictures over top of it. She had Addison's disease, which is inherited hypoadrenocorticism, the opposite of Cushing's disease. So her adrenal gland cannot normally make cortisol, and she also can't make mineralocorticoids. And so she has to be treated for this. The adrenal glands will be progressively destroyed, just like the thyroid gland is progressively destroyed. And she had the atypical form of Addison's disease, which I won't go into in detail. And she had inflammatory bowel disease, which is another immune-mediated problem where she couldn't tolerate foods normally. So here she was at 16 months of age, and she still had hair on her tail and some general hair over her body. As her disease progressed, in addition to Addison's disease and the bowel problem, she became hypothyroid. Now she's 2 years and 7 months old, and she's a therapy dog in a hospital with a person in a wheelchair. And you can see that she's lost her hair here. She doesn't look very happy, and her hair coat is scruffy. Now it's a month later, and here she's hypothyroid again, looking at a patient in the hospital. She's losing some of the feather on her tail. She's bald here and here, bald on her belly, bald here, and she certainly looks terrible. After the diagnosis of hypothyroidism, at 2 years and 11 months of age, which is 3 months after the last picture I showed you, she's starting to get her energy back. Her tail is still poor. Her hair has grown in here. Her hair in her belly has grown in, and she's looking much better. And we have one more picture of her at 8 thyroid therapy, playing in the snow where all of her coat is growing back, and her tail is the same bushy tail with the feathers that she had when she was much younger. And so thyroid disease can progress and be treated and be normalized, everything as shown in these slides. Now here's a dog with hypothyroid with the dry skin and the onion skin-like paper. This is serum that is drying on the edge of the lesion, and there's this tiny thin layer of skin over top of this lesion which you can peel off. So this is, again, the end stages of the crisis of hypothyroidism, with pigment in the center and the serum oozing on the edge. Obviously, it doesn't feel very good. Here's a hypothyroid dog that has no undercoat. All you have left is these guard hairs and some crummy-looking skin scales here. So there's no undercoat. It's all gone. And the part of the skin that was brown is now brown and really much more visible than it would be in the part of the hairs that are still not yet fallen out. Here's a dog with dry, flaky skin, huge amounts of dandruff. This was a Belgian Shepherd. And the people used to comb the hair over the dog gently so you couldn't see the flakes. The problem was when we went into the examination room, the dog shook itself and all this dry skin flew in the air and we all started sneezing. This dog had huge flakes of dry skin underneath the coat. So the next form of hypothyroidism that we worry about is neuromuscular problems, where the nerves controlling the muscles are not normal. So we have weakness, strong. In fact, if you stand the dog up and you put your hand down the middle of the spine and you keep moving it down towards the pelvis, the dog will usually collapse, or scooch down low and then eventually fall over or fall down. They can be stiff. They can change the character of their bark because their larynx isn't working normally. And so instead of having a long, throaty bark, they have a little lippy bark, which you may think is wonderful because they don't bother people so much anymore, but that's not normal. Paralyzed, as I showed you, and they have a sad, tragic expression. When the face is paralyzed, one side of the face can look different than the other. They can knuckle or drag their feet. Their muscles can be wasted behind the shoulders, on the hind end. When you squeeze the rear leg muscles in the back, they're losing muscle mass, or in the head, underneath the eyes and above the head. The esophagus can be flabby because smooth muscle tone has changed, and so they can't swallow and digest hard, crunchy foods anymore. And so you have to end up making the food soft and mushing it up. And so you do that and the animal can eat and you think, oh, well, there's no problem. But in fact, it's because the esophagus isn't working properly. You can have a problem with the inner ear, which is called vestibular syndrome. So the head has a tilt where one ear or the other isn't the same. And so they're holding the head to one side or the other. The eyelids can be droopy because you've got lack muscle tone. So everything is flabby. Here's a picture of a dog that was sterile and came to our friend who's a reproduction specialist, Dr. Stockner, because this Belgian Tervuren was sterile. And she said, wait a minute, the dog is sterile, but I'm looking at this muscle wasting here above her eyes. All of this muscle has gone. This dog, to me, is going to be hypothyroid, and she's lost some hair under her eye. So she was concentrating on the muscles that made the dog's head look like an Afghan hound. And she said, sterility is also present, but this is the problem. And then we have a picture of a golden retriever named Toby that had an autoimmune thyroid disease and was never diagnosed until they came to see us. And I looked at Toby and I said, my God, look at this temporal muscle wasting. You could put your thumb in behind the zygomatic arch above the eyes here and inch into that hole. Well, it's a huge problem. And this poor dog had autoimmune thyroid disease, which, by the way, can take 4 to 7 months of treatment before the muscle mass starts to fill in again. This dog, 4 months later, had a cancer of the spleen and had hemangiosarcoma and had to be put to sleep. That didn't have anything to do with this, but this poor dog had many problems that golden retrievers suffer from.